Welcome to Health Matters on Channels Television, and thank you for joining us. I am Mary Alale Yusuf. By Friday, February 4th, more than 391 million confirmed cases of COVID-19 were on the global records, with a death toll of over 5.7 million. In Nigeria, there were more than 253,000 confirmed cases, and deaths are 3,136. More than 10 billion vaccines have been given globally, and in Nigeria, 13.9% of those 18 and above have got a first dose, while 5.3% are fully vaccinated. Now, on to the topic of the day. Cancer happens when mutations occur in genes that regulate cell growth. These mutations allow cells to divide and multiply in an uncontrolled way. Breast cancer is cancer that develops in breast cells. Cervical cancer develops in a woman's cervix, which is the entrance to the uterus. Cervical cancer is the fourth most common cancer in women. And in 2018, about 570,000 women were diagnosed with cervical cancer worldwide, and about 311,000 women died of it. When diagnosed, cervical cancer is one of the most successfully treatable forms of cancer. The Rose of Sharon Foundation, dedicated to helping widows and orphans, has decided to start the women off on a healthy note in 2022 with free cancer screening. Widows in Lagos were treated to a lecture on breast and cervical cancers prior to being screened, and those who needed it got free treatment for their condition. It's all in this report. The women gathered in this building all have one thing in common. They are widows. Rose of Sharon Foundation is partnering with Optimal Cancer Care Foundation to screen each one of them for breast and cervical cancer. But first comes some education.
Some cells that are supposed to have died are forgotten. They will continue to grow. So when they are growing, all your nutrients are going there. They're supposed to go somewhere else for development, for the good health of your body. And until you go there to remove it, they will continue to grow until the person dies.
He explains further that the condition always starts small and takes a long time to deteriorate, which makes screening imperative for catching it early enough to treat.
So, if you touch 12 o'clock and there's no lump, then lift your fingers and go to 3 o'clock. Look at what she's doing.
It's a full package of awareness creation as the women learn how to examine their breasts for abnormalities every month. They then take turns to get screened for both cancers behind the privacy curtain. According to the expert, 1 in 10 women has changes in the cervix which need to be quickly addressed to prevent cancer.
The majority of women who are dying from breast and cervical cancer have been failed by our government and lack of access to cancer screening programs. And it's not expensive to organize cancer screening programs for our women.
We do our healthcare programs with skilled healthcare professionals in different fields of health who provide free healthcare services for our widows. So we came in contact with Optimal Cancer Care Foundation and we decided to partner with them because that's what they have been doing for over a decade.
For about 14 years, the Rose of Sharon Foundation has been helping widows, children and orphans live healthy and productive lives in other areas as well, such as education and empowerment for financial independence. Okay, my guest on the show today is consultant radiation and clinical oncologist at the NSIA Luth Cancer Center in Idiaraba. She's also the treasurer of the Association of Radiation and Clinical Oncologists in Nigeria. Dr. Bolale Adegboyega, you're welcome to the show.
Thank you very much. Thank you for having me.
Obviously, the biggest risk factor for breast cancer would be being a woman.
Yeah.
What are other risk factors?
Other risk factors for breast cancer include age. As people grow older, tendency to develop cancers actually come up. Others are, if you don't early menarche, late menopause.
Okay.
Those that start
early menarche, starting
late,
the period
earlier
than usual.
Yeah. And then late menopause, stopping menstruating later than normal.
I thought that was good.
The usual range should be between 48 and 52 years. So
Okay.
some people actually do it longer than that. Breastfeeding has been found to be protective. So those that do not breastfeed their children, at least for like 6 months and beyond, can actually be a risk. People that are nulliparity, not getting married, not having children, can also be a risk. Obesity is also associated with breast cancer. Alcohol intake is associated with breast cancer. Some studies advocate as hormone contraceptive pills, but this is not quite common, but it's also associated. So smoking too can also be associated with breast cancer.
I think smoking is associated with everything bad.
Well, commoner with head and neck cancers, though.
Okay,
But
because that's
also
closer to the smoke anyway.
Yeah.
All right, so experts are always harping on early detection, early detection, early detection. How do you detect, apart from what we saw with the palpation that those women were doing, how do you detect a breast cancer early?
Actually, the best way to detect a breast cancer early is actually the palpation.
Okay.
Breast cancer, because it's outside, so tendency to detect early is easier if you stay in touch. Get used to normal, such that if anything comes up, you're able to pick that this is not the normal feel, the normal size, the normal texture of the breast. Then you also look, it's part of the self-breast examination, you look at the color, skin changes, you look at the nipple. Is it going inside, which is not supposed to, maybe had not been like that before? Then you also press, you press it. Is there any discharge? When you're not breastfeeding and you're having discharge, and at times the discharge may also be bloody. Then you also check the armpits. So because at times it may not start from the breast, it may actually start from the armpits. So that's the best is self-breast examination, which we advocate to do once a month. Then now go to clinical breast examination. That is when a doctor, a trained personnel actually examine you, such that there are things you may not know and they may be able to pick earlier. Then for those that are below 40 years, breast ultrasound is good for screening, especially if they have strong history or they are at risk. And then for those that are, for those that are above 40 years and above, you also do mammogram. So those are the basic ways to. Then there's also a place of tumor markers. It's also necessary.
Tumor markers.
Tumor markers. There are blood tests that can be, especially for those that have, they are more at risk. It can also be used to know if there is tendency for this person or if the tumor is actually.
Continue, please.
Okay, sorry. Bless you. So after if there's any lump, then the next phase is to do imaging. Just like mammogram I've mentioned, then if there's any lump detected, a needle test is actually done to take the sample, send it to the lab. If it's malignant or if it's not, that's the basic way to diagnose breast cancer. So if it is diagnosed, then you go in, we do other imaging to try to stage it, and with that, you now talk about treatments.
So what you're actually looking for is a lump.
A lump in most cases, but it's not always a lump. At times, maybe skin changes. That's some type of cancer that starts like that. So it may not come as a lump. In fact, it's called inflammatory breast cancer, and it can be quite aggressive. Though it's not common, it's not as common as a lump.
Do young people have it?
Young people, yes, do have breast cancer. And the kind of cancer in them is even more aggressive. We've seen patients as even younger than 20 years. I have a patient currently now, she's 22 years. So young people do have breast cancer.
Okay, so how often should one get screened?
Screening should be once or twice every year. But for those that risk, it should be yearly or every 2 years. But for those that risk, it should actually be more frequent. And then for those that have, those that risk generally, it could be family history, it could be that they've had past breast diseases, and people that have had lump in the time past, it can actually be more frequent. But at least once a year is fair enough.
Okay, so when maybe you've done a biopsy, you find that the lump is benign. There's nothing wrong with the lump. It's not cancerous. Do you still take it out?
That's the best, because the biopsy you are doing is just a needle test. takes a quite small, it's a small bit that is taken out. So it's still advocated, but that's the best way to start, do a needle test. If it is benign, then go ahead, remove the whole lump, then send to the lab. So in such a case, the pathologist add more sample to work with, and then they may be able to detect something much more. Because if you are using needle, you might have missed where the problem is, really. Okay. And it may actually come out being normal, whereas it's not actually normal. So a needle test that is saying there is a benign stuff, you should still go ahead and do a lumpectomy and send to the lab.
Okay, so here is the million-dollar question. What is the survival rate? Assuming women now become very responsible for themselves, they are checking, they are screening and everything, what is the survival rate?
Survival rate for breast cancer, if they present early stage 1, stage 2, can be up to 80% or more.
Wow.
It's quite high. Provided, but there are other things that are put into it. The type of breast cancer, some breast cancer tends to be more aggressive. I mentioned if it happens in younger age group, they tend to have what we call triple negative, and in that case, it can actually be
that's the triple negative.
That's the triple negative.
It grows faster.
It grows faster. It's commoner in the blacks, commoner in the younger age group, and then the prognosis is a bit poorer, especially in the first 5 years of diagnosis. But then if a patient presents early, it can be up to 80%.
Okay, there's something they call 5-year survival rate. Why 5 year? Why not life? I mean, it's scary. It's like, oh, do I have only 5 years to live or something?
No, 5-year survival rate is that from all the studies done, you want to follow up for 5 years. How many more are still alive or whatever? Then you can now go on to 10 years. So it's not as if it's based on the number of studies that have been done, the population as a whole, and then something substantial you can come up with.
Okay, so let's talk about cervical cancer. I'm a bit happy about this one because I read that it's like 99% preventable.
Yeah.
That is so beautiful. Yet, look at how many people died of it. In that statistic in 2018, it was more than half of the number of people who came down with it that year. More than half of them died, 311,000. Why?
Cervical cancer, I would even like to correct a notion. It's actually the second commonest cancer in Nigerian women, not the fourth.
No, fourth in the world.
In the whole world. But in Nigeria, it's even commoner, yes.
Okay.
It's the second commonest cancer in Nigerian women. And just like I've said, it's highly preventable. And then if it's detected early too, you can also achieve a cure. So that's why we're talking about awareness. People are not aware. People are not aware. And when it happens, people start looking for... It's an arrow. It's somebody is behind
something
it.
Spiritual.
So you start going to the wrong place, and by the time you are eventually coming to the hospital, financially they are drained. They don't even have money for the treatment, and they are coming at a stage that doctors can only manage and no longer treat or cure.
Okay, so on that note, we'll go on a short break. When we come back, we'll continue with the cervical cancer. Please stay with us. We'll be back soon. Welcome back. We're talking about breast and cervical cancer and ways to prevent and treat them. This is Health Matters on Channels Television. You can tweet at CTV_Mary A with your questions on breast and cervical cancer or your comments on them. Dr. Adegboyega, there is a vaccine for cervical cancer, which honestly, I didn't hear of it too long ago, maybe a decade ago at the most. Why are people afraid of that vaccine? I have to ask that first because that is the reaction I get, you know.
Well, just like you said, that you just said about it like less than a decade ago. So it still boils down to awareness. You can imagine the vaccines that have been in the picture a long time ago for polio vaccine, stuff like that. People are still... There are so many whatever around it, and in the north, people are still rejecting it. How much more? This is rather a new technology. So it's just a matter of time. I can tell you that the body language in the last 1 year has changed compared to what it used to be. And now there are lots of advocacy that it should actually be included in the routine pentavalent vaccines that we give our children. Why? Because
that would be beautiful.
And there have been a lot of tweets, a lot of issues are going on that, and people are putting their voice. We hope that one of these days it will be taken up by the government. Why? Because it's even more effective in the younger age, people that have not had any sexual exposure, such that, like 9 to 13 years, so if they are vaccinated that early, it prevents them from coming down with cervical cancer later in life. So it's about awareness. People are getting more aware. People are...
This prevention, how effective is it? Is this what is making it 99% preventable?
Well, it's part of it.
Itself?
Yes, the vaccine is one of it. The other one is pap smear. Pap smear, so people do it even when you do not have. And then when it's, before it even becomes cancerous, lesions can be detected. We call it CIN. It's still in there. It's not yet a full-blown cancer. Such that even if it's detected at that early stage, surgeries could be done, procedures could be done to even remove it.
So a precancerous lesion?
Lesions can be detected.
How do they, so what do? They go in there and cut it out or what?
Precancerous lesion, it depends on how far it is. There can be surgery. People can remove the whole womb to the cervix to remove the whole. There can be a kind of therapy, cryotherapy, and stuff like that to treat.
They freeze it?
Freezing.
So the freezing will inactivate whatever lesion is there?
Is there, yep.
99% is a pretty good number, I must tell
Then
you.
apart from pap smear, there's also another screening, which is HPV. It's also a bit another level too. And then if you do HPV, in fact, the coverage is to tell whether the virus that is responsible for close to 70% or more of cervical cancer, it's in that particular person. So if the HPV testing is done, and if it is positive, person can go for treatment or go for further testing. If it's not positive, then you know that in the next 3-4 years, you can actually repeat it to check.
Okay. How available is this vaccine right now in Nigeria?
I feel it's quite available. My children are vaccinated, and we got it. It's quite available.
Okay, so you say that it's somebody who is not sexually active that is usually recommended for this. But how about older people who are perhaps not positive to the HPV virus? Can they take it?
They can still take it. It causes no harm. Only that studies have shown that it's more effective at that age. And then we don't want a situation that an elderly person now feels that I've taken this vaccine, that I don't have to go for my screening again. So you can as well take it, but still the place of screening is not yet removed.
Okay. All right. So I've also heard about vaccination of boys. Where does that come in? Are they the carriers of the HPV? Is that why?
HPV causes cervical cancer, but it's also responsible for some head and neck cancers, which can occur in boys or girls, either way. So if you prevent those strain of HPV, it also prevents them from developing head and neck cancers that are connected to those HPV viruses. And at the same time, a boy that is vaccinated will also not be able to infect a girl during sexual intercourse. So it also is a double one. The boy is prevented from head and neck cancer, and then the boy will not be able to infect a girl. So the girl too will not be able to come down with cervical cancer. You know, cervical cancer is sexually transmitted. So boys can infect girls with HPV, and then it's girl that will develop cervical cancer.
Do the girls get to infect any other person? Is it something that they can also pass around?
It's a sexually transmitted disease. So lesbians or whoever can also reinfect.
That is pretty heavy. So is there any self-examination for this particular type of cancer?
Cervical cancer, because like you said, cervix is rather inside, unlike breast. So self-examination may not be the way to go. Rather, go for pap smear. In that way, the specialist check, and then they now do further testing on it. But for the pap smear, I know that there's a place of self-collection for the pap smear, where they do like a swab. But then for you to actually see, it may not be possible to do it on yourself.
Okay. So how often does one have to go for screening, you know, for a cervical screening?
Well, how often would depend on your sexual activity, in quotes.
Okay.
If you know there's a place, there's no, I don't know how to put it. You are faithful in a sexual relationship. You don't have
several partners.
Because one of these risk factor of cervical cancer is having multiple sexual partners or having partners that have multiple sexual partners.
So they just pass it around.
So if these are not in place, I think once a year is fair enough. But when you have that risk, then you may actually need to do it more often, maybe 6 monthly.
How about somebody who has been vaccinated and is now grown up? Does that person need to screen?
I think so, at that age. you may still need to screen. You have nothing to lose. Why you may be able to
This
talk
is
for
what
yourself.
people say about vaccines. They say it's going to protect us, yet you still have to go for tests.
Screening is once a year. I think pap smear is like 10,000 or thereabouts once a year. I don't think that's too much to do, especially when you can vouch for you have one sexual partner and you are sure that person. But times that you can't really vouch, I don't think it's too much for you to do to protect yourself, really.
Okay, so how about the breast cancer screening? How much does that cost?
Breast cancer screening, ultrasound should be like around 10,000. Mammogram can be like around 10,000 also.
Does one have to do both, or do they do the same job?
Not necessarily.
Because
they
the
usually
ultrasound sounds like a better...
They usually do the same job, but for different age group. Okay. Ultrasound is for younger age group, 40 years and below. Why mammogram? Because at that place, when it's getting to mammogram, the fat in the breast is lesser. So for some, they may need to do both. If you do with mammogram and the breast is too dense, they are not seeing what they are supposed to do, they may also still ask the person to do ultrasound. So some people may end up doing both.
So we're talking about 99% reduction in cervical cancers, and how much reduction in breast cancers? With the screening. With the screening, with the early detection.
Well, I'm sure it's quite significant. I may not have a figure to put to it, but it's quite significant. Such that even if it's not prevented in breast cancer, it's detected early, and then chances at cure is quite high.
Do men ever get breast cancer?
Yes.
How are they co-opted into all this?
Well, just like we said that, just like a woman will examine their breast, men too should also. I remember I once had a patient.
I'm sure men are shaking their heads now. I mean, how do you tell a man to come for screening?
Okay, breast cancer in men accounts for 1% of breast cancer generally. Okay. I once had a patient, we lost him. And then one thing he said was that if only his wife, he was a widower, that if only his wife were to be alive, she would have detected the breast cancer in him earlier because the woman would have touched. Okay. So if men cannot touch, their wives can actually touch for them. So it's just for them to also know that something is not normal in this place.
Should they also notice the same changes the woman is looking for? Changes in texture, lumps.
In the size. Some of them have skin changes. Some may even have discharge, but usually may even be bigger than normal. So it's just same changes too. Okay,
that's a really great talk. What blew me away was that cervical cancer is the second most common cancer in Nigeria. Among women or generally
among women. In men, prostate cancer is the first in them.
Thank you so much for coming to the show, Dr. Adegboyega. This has been wonderful. So, men, please do touch. Make sure you don't have breast cancer. Don't say, had I known. And thank you so much for being on the show with us. Have a great day. I am Mary Alale Yusuf.